Now, we told you a moment ago that 332 people are in hospital with COVID-19 here in BC, but how accurate are the numbers the province is giving us? CTV News has learned there are more patients still sick in hospital, but not being counted. Penny Daflos now on the true numbers seen only by healthcare insiders.
British Columbia's intensive care units are swamped with critically ill patients in overwhelmed northern ICUs now sent to hospitals around the province. How can things be so much worse now than the second wave when there were more ICU cases? It may be a question of how patients are counted.
In the province of BC, someone in ICU with COVID is no longer counted in the public hospitalization numbers when they've been there long enough that they're no longer infectious to others.
In Vancouver Coastal Health, they call them off precautions because staff no longer have to take extra care to make sure they're not infected by the virus. Internally, the health authority used to reveal those numbers weekly to a wide group of staff, but stopped in July. Now only a small group sees the true numbers that aren't streamlined.
We call them time cleared.
Fraser Health uses a different term for past infectious COVID patients.
What that means is they can no longer infect other individuals. Their COVID has probably run through in terms of the infective period, but the after effects on their lungs and other organs are still there. And so they're still in our hospital.
Royal Columbian Hospital is still caring for COVID patients there since the third wave in the spring. They are not counted in the government published statistics.
What we report on a daily basis as well is based on the epidemiologic information and on the census information.
CTV News asked the province's top doctor how many patients are still in hospital due to COVID and not counted. Manitoba reports that number daily, but Henry wouldn't say.
What we present in our data is the epidemiologic numbers, and that's the way we've done it from the very beginning. It helps us understand severity of illness.
Unless government adopts full transparency around COVID hospitalizations, British Columbians may never know the true impact of the virus on people and our deteriorating healthcare system. Penny Daflos, CTV News, Vancouver.